Hey, I'm Dr. Alex McCree here. I'm here with Dr. Forrest Quiggle, one of our anesthesiologists that we have come by and help administer sedation at our office. Obviously, there's been some things that go on in the news that, so with some sedation issues at dental offices. And so I found it prudent to, I've said online, and here many times that we have an anesthesiologist come in. Well, today I'm actually going to talk with one. What would you say is this, from a 1 to 10, most of the things you do at a dental office compared to like these very maybe advanced cases that you do?
Probably most anesthesiologists would consider the dental cases a little bit on the easier side because it's not a major surgery, there's not major blood loss. But nevertheless, anytime you give anesthesia, there are always risks, and even simple cases can go bad and have catastrophic outcomes if you're not careful.
Yeah, I mean, that's why I'm having this conversation, was because, I'm trained in it. My partner, Dr. Russell, he's trained in it, but not near to level of what Dr. Quiggle is. If I was administering sedation myself, I would keep it very, very light. But obviously a lot of people want to go a little bit deeper. They want to feel more comfortable. That's where, yeah, I might be trained for it somewhat, but there's no replacement for the experience that someone, and also that's not my full-time job. Like that's a part-time thing that I would do as a dentist. Whereas, this is what he devoted his entire life to. If you had to throw a number, how many sedations do you think you've administered in your career?
Thousands of cases, and it's all that experience to know really how to save a person when things go bad.
Yeah, I mean, so, a joke earlier said, you don't hire the pilot to make the plane take off, it's to land the plane. So similar with you.
Correct. I mean, a lot of patients, when you talk to them before the procedure, their biggest question is, or concern is, will I wake up? And obviously we kind of joke about it, but like your analogy, it's easy to put the plane in the air, but you also have to land it as well.
Yeah. So yeah, I mean, we'll keep it short, but I just want to at least introduce, one of the anesthesiologists that we have here when we're doing IV sedation, and just kind of give a little bit of background of what an anesthesiologist is. Not that there's not different levels, right? There's CRNAs, there's different levels, but what we have here is not what I consider is factual, is the top level of anesthesia care that's available today. So this is Dr. Forrest Quiggle, I'm Dr. Alex McCree. Thanks for watching.